On her first shift, a storm slammed into St. Northwatch General Hospital. The chief surgeon smirked outside the briefing room. New nurse? Learn the protocols first. Don't try to teach us emergency medicine. Thunder crashed. The lights died. The backup generator stuttered, then failed. The elevator groaned, then went silent. 12 minutes later, that same new nurse with long brown hair was pumping an ambu bag in the pitch-black hallway. The chief's 17-year-old son lying unconscious on the stretcher. The entire hospital held its breath. Irena Vale was 29 years old, with Austrian-Hungarian heritage. Her long brown hair was always pulled back in a low ponytail, and she had the kind of sharp, cold beauty that made people look twice. But her eyes were warm, and her voice was deep and clear. She wore the standard charcoal RN uniform with worn non-slip shoes. On her left wrist was a thin scar like a thread line. Her right index finger had a callus across the first knuckle from years of writing in difficult conditions. St. Northwatch General Hospital sat right on the coast. Every storm season, the power grid flickered and failed. The ambulance bay flooded halfway up the steps when rain pounded the building. Dr. Adrian Keller was the chief surgeon, 52 years old, with a legendary reputation and a harsh personality. His favorite saying was, "We follow protocols here, not feelings." On Irena's first morning handoff, she suggested placing glow-in-the-dark tape arrows along the stairwells for power outage scenarios. Dr. Keller waved her off dismissively. "We have backup generators. New nurses should worry about paperwork first." A young nurse giggled. "You're thinking too far ahead." The way people looked at her was obvious. Pretty, but inexperienced. Probably panics when she hears code blue. Paramedic work on the street is different from hospital work. Irena didn't argue back. She just made her rounds like always. She changed the batteries in the headlamps on the crash carts, tested the oxygen valves, and hid 2 waterproof pens in her scrub pockets. Nobody noticed the small things she did quietly. She placed reflective arrow tape along the baseboards leading from the ambulance bay to the ED resuscitation area. She reminded people about backup battery procedures for suction machines. She put non-slip towels at the curved corners of hallways where people might fall. During one typical case, an acute asthma attack arriving in the ED, Irena said quietly, "Oxygen before paperwork." The resident frowned. "Don't try to teach doctors." Irena stepped back half a step, placed the oxygen mask, and clearly read the missed report. Mechanism, injury, signs, treatment. The patient's oxygen saturation improved. Nobody said anything more. That afternoon, dark clouds pressed down and the wind changed direction, hitting sideways. Irena tilted her face up for half a second, listening to the rain gutters choking with an irregular rhythm. The backup generator might overload if the storm hit the power station. She slipped glow-in-the-dark tape into her pocket. At the end of her shift, Dr. Keller looked at Irena's checklist. "We don't need low-lighting zone division corridor management like we're running a coffee shop. This hospital has procedures." The whole room forced uncomfortable laughs. Irena smiled thinly. "I believe in procedures. I also prepare for when procedures lose power." That night, alone in her small apartment, Irena pulled a burned piece of parachute fabric from her wallet. Embroidered on it in faded thread was 7:19, the exact time she had once opened a corridor for a team to escape through Korav Pass. She never told anyone about that day, but she touched the fabric before every storm shift, remembering that sometimes the difference between life and death was as simple as someone knowing which way to go in the dark. In Irena's wallet, carefully preserved, was a piece of burned parachute fabric embroidered with 7:19, the time she once opened a corridor for a team to escape Korav Pass. She never spoke about it, only touched it before storm shifts. The rain started at 7:10 p.m., with the tide rising and water pouring into the ambulance bay. A chain reaction accident on the coastal bridge brought multiple casualties, and EMS called in a level 2 mass casualty incident. The bay floor was slick as ice. The power grid flickered constantly. Irena requested permission to implement storm protocols, Low lighting in the ED, designated hot zones near resuscitation areas, cold zones in secondary corridors, and arrow markings for non-crossing entry and exit paths. The charge nurse hesitated. "Let's wait for the chief." The chief was busy in surgery. "Don't change the protocols." At 7:26, lightning struck. The lights died instantly. The backup generator jolted to life, then stuttered and failed. The UPS battery backups from monitors blinked and went dark. The elevator got stuck between the second and third floors, with several people trapped inside. A 17-year-old volunteer in a hospital shirt collapsed in the corner of the stairwell, wheezing from diesel fumes leaking from the failed generator. His name was Lucas Keller, the chief's son. In the complete darkness, Irena's voice cut clearly through the corridor for everyone to hear. Low lighting, reduce stimulation, prevent panic. Hot and cold zones. Hot equals immediate intervention. Cold equals stable waiting. Open the corridor. Apply arrow tape. Separate incoming and outgoing traffic. She distributed headlamps from the crash carts to 3 people. Without any electricity, she began setting up systems that worked in the dark. Glow-in-the-dark tape along the baseboards created arrows leading from the bay to resuscitation. Non-slip towels covered the wet steps. Security held directional signs. Enter, right exit, left. The first patient arrived with breathing difficulty, but the monitors were dead, so oxygen saturation couldn't be measured. Irena placed an oxygen mask manually and counted chest rise visually, 12, 14, up to 18 respirations per minute. The second patient had a bleeding thigh wound. She applied a tourniquet and wrote the time with waterproof pen directly on the bandage. The third patient was in cold shock. She wrapped him in space blankets and moved him to the cold zone. Then security ran over with urgent news. "The elevator is stuck outside or 2. There's a kid inside wheezing, and his face is turning blue." Irena turned and headed toward the elevator. The elevator cabin was pitch black and reeked of diesel fuel. Inside, Lucas was breathing with a harsh wheeze, lips purple, hands shaking. 2 medical students were panicking, and a nurse was uselessly pounding on the doors. Irena lowered her voice. "Listen to me. No flames. Keep lighting low." She examined his neck and chest, checking his breathing pattern. She saw intercostal retractions and prolonged expiration asthma attack triggered by diesel fumes. Before anyone could start filling out forms, Irena inserted a nasopharyngeal airway tube of the appropriate size through his nose and lifted his chin. She had a bag valve mask and portable oxygen tank from the crash cart. Without monitors, she counted chest compressions visually. "Breathe with me, 1, 2, 3. A family member unconsciously flicked a lighter to see better. Irena grasped their wrist and gently bent it in a biomechanically natural direction, just enough discomfort to make them drop the lighter. No flames near oxygen, clear and sufficient. She called to security. "Get the technical team to pry open the door with crowbars. Call ED for nebulizer and epinephrine IM. Don't wait for the generator." She turned back to Lucas. "Look at me. Breathe." Dr. Keller came running down the dark corridor, face pale, hands shaking. "Lucas!" He froze when he saw Irena pumping the ambu bag while coordinating like a field commander. He started to speak. "Let me—" Irena didn't look at him, her voice steady and low. "Airway first. Doctor, please hold his head tilted left." The door was pried open just a crack, but more smoke poured in. Lucas wheezed harder, his lips turning more purple. Irena quickly assessed. Probable bronchospasm plus mild allergic reaction. She pulled out her waterproof pen and wrote in large letters on her own wrist. EPI 0.3 IM right thigh. So anyone arriving later wouldn't need to ask questions. The smoke was getting thicker. Through the narrow opening, she could see more people gathering in the hallway. Some had flashlights, others had phone lights creating chaotic shadows. Lucas's breathing was becoming more labored. Irena made a decision that went beyond standard protocols. "I need epinephrine 0.3 milligrams intramuscular and a nebulizer with albuterol. Now." Doctor. Keller looked at her with a mixture of fear and growing respect. His son's life was in the hands of the nurse he had dismissed that morning. On Irena's left wrist was a thin red cord tied in 3 knots. When a medical student asked about it, she only said, 3 blackouts, 3 people still breathing. Then she pulled her sleeve down. The epinephrine arrived within minutes. Irena guided the nurse through the intramuscular injection into Lucas's right thigh, while simultaneously administering albuterol through the bag valve mask using a special adapter. Dr. Keller held his son's head steady, lips pressed tight, eyes wet with tears. The elevator door was pried wider. Irena gave clear signals. Corridor protocol. Enter on the right, exit on the left. Keep low lighting. No flames. A stretcher was wheeled in. Irena continued pumping the ambu bag in steady rhythm. 1, 2, 1, 2. Gradually, the chest retractions lessened and his lips began to return to normal color. Irena placed her hand on his sternum, feeling the vibration, more steady now. She nodded very slightly. Dr. Keller released a long-held breath. The chief spoke quietly, his voice breaking slightly. I'm sorry about this morning. In the briefing, Irena didn't look up from her patient. Talk after we get him to resuscitation. Right now, airway first. In the resuscitation bay, with all monitors still dead and backup suction barely working, Irena organized the team. 1 person counting pulse rate every 30 seconds. 1 person observing chest rise and fall. 1 person recording medication times and nebulizer treatments on tape stuck to their wrist. Documentation comes later. Breathing comes first. The bronchospasm flared again when diesel fumes drifted in. Irena switched to PEEP valve on the bag valve mask, set to 2 to 4 centimeters of water pressure, her voice steady. Don't let the lungs collapse. Dr. Keller watched her like a student watching a professor. That's when Lieutenant Commander Marcus appeared with Doc Miller from Emergency Medicine. Marcus looked at Irena and said quietly, "Wind and breath over fear." Dr. Keller was surprised. "You two know her?" Marcus nodded. "She's not one of your soldiers, but twice my team made it home because of her low-light zone division corridor protocols." Marcus looked at the thin red cord with 3 knots on Irena's wrist. Ghost 11, Korav Pass, 0719 hours. Radio communications dead. She opened a corridor using glow tape and 3 simple commands. The resuscitation room fell silent. Dr. Keller stood straighter, his lips trembling. You saved my son." Irena shook her head, rejecting the title. "The team saved him. I just kept the path open." She looked up, meeting the chief's eyes directly. "I apologize for being inflexible this morning, but when the power dies, protocols go silent. The corridor has to speak." The auxiliary power flickered back on intermittently. On a wet tarp, Irena drew a diagram of the bay to resuscitation flow. Oxygen, paperwork, mask before forms, hot-cold, separate intervention from waiting. Corridor, entry and exit arrows that don't cross. We don't need heroes. We need someone to keep the path clear. Dr. Keller asked the right question. "What should we do first thing tomorrow morning?" Irena replied, "Place glow arrows throughout all stairwells. Practice low light, zone division, corridor at the end of every shift, and attach standard PEEP valves to every bag valve mask on every crash cart." In a very human moment, Lucas opened his eyes and whispered, I heard your voice in the dark." Dr. Keller bowed his head, squeezing both his son's hand and Irena's. "Thank you." But there was more to the story that nobody in the hospital knew. Ghost 11 wasn't just a call sign. It was a designation from a classified military medical unit that specialized in combat casualty care under impossible conditions. Irena had been trained not just as a nurse, but as a field medic capable of making life or death decisions when all normal support systems failed. She had served in 3 different conflict zones where medical teams had to operate without power, without backup, without the luxury of following standard protocols. She had learned to read vital signs by touch, to perform emergency procedures by headlamp, and most importantly, to keep teams organized and moving when everything around them was falling apart. The red cord with 3 knots represented 3 separate incidents where her blackout protocols had saved multiple lives. Each knot was tied after a mission where she had successfully guided medical teams through crisis situations in complete darkness. Korav Pass had been the worst. A medical convoy ambushed at dawn, radios jammed, vehicles destroyed, and 12 wounded soldiers trapped in a canyon with enemy forces closing in. For 4 hours, Irena had coordinated the evacuation, using nothing but glow tape, hand signals, and the same 3 principles she had just used in the hospital. Low lighting to prevent panic and preserve night vision. Hot and cold zones to prioritize the most critical cases. Corridor management to keep people moving in the right direction under stress. Every person in that convoy had made it home alive, but Ghost 11 operations were classified beyond normal military records. As far as anyone knew, Irena Vale was just a civilian nurse with unusually good crisis management skills. The training had been brutal. 18 months of learning to work in complete darkness, treating wounds by touch alone, managing teams when radio communications failed. They had practiced in abandoned buildings, flooded tunnels, and simulated disaster zones where nothing worked the way it was supposed to. Most recruits washed out within the first month. The psychological pressure of making life or death decisions without backup, without clear authority, without the safety net of established protocols, it broke people who looked strong on paper. But Irena had something different. While others panicked when the lights went out, she became calmer. When chaos erupted around her, she found clarity. When systems failed, she improvised better ones. Her instructors had called it dark vision. Not the ability to see in darkness, but the ability to find order in chaos. To see patterns and solutions that others missed when everything was falling apart. The night at Korav Pass had tested every skill they'd taught her. 12 wounded soldiers, enemy forces closing in, no radio contact with base, and a medical evacuation that had to happen in complete silence. For 4 hours, she had coordinated the rescue using nothing but hand signals, glow tape, and those 3 simple principles. Hot zone, the soldiers who needed immediate intervention to survive. Cold zone, the walking wounded who could wait. Corridor, the safest path from the ambush site to the extraction point. Every decision had been hers alone. Every life had depended on her ability to stay calm and think clearly when others were paralyzed by fear. The psychological evaluation after Korav Pass had noted something unusual. While most combat medics showed signs of stress and trauma after such missions, Irena had scored higher on clarity and decision-making tests. The darkness didn't break her. It revealed her true capabilities. That's why they had given her the Ghost 11 designation, not because she was invisible, but because she appeared exactly when and where she was needed most, usually in situations where everyone else had given up hope. After her military service ended, Irena had deliberately chosen civilian nursing. She wanted to use her skills to help people without the weight of classified operations and secret missions. She thought she could leave Ghost 11 behind and just be a regular nurse. But skills like hers don't stay hidden forever. Crisis has a way of calling people back to what they do best. Standing in this darkened hospital, watching Dr. Keller process what had just happened, Irena realized something important. Ghost 11 hadn't been a job. It had been training for moments exactly like this one. The military had taught her to save soldiers in war zones. But those same skills worked just as well for saving a 17-year-old boy in a hospital elevator. The principles didn't change whether you were in a combat zone or a medical emergency. When systems fail, someone needs to create new ones. When people panic, someone needs to stay calm. When the lights go out, someone needs to show others the way. Now, in this hospital resuscitation room, Dr. Keller was seeing that same capability in action. Dr. Keller looked at the simple diagram she had drawn on the tarp. 3 basic principles that had just saved his son's life. How long have you been doing this? Long enough to know that when people can't see where they're going, someone has to light the way. The storm was beginning to pass outside, but the lessons it had taught would reshape how St. Northwatch General Hospital prepared for emergencies. Type, I owe a debt, if someone unknown ever kept your breath coming back in the darkness. 1 week after the storm, a small sign appeared in the ambulance bay. Oxygen paperwork. Hot-cold zones. Corridor protocol. Low lighting fixtures were installed throughout the ED corridors. Glow-in-the-dark arrow tape marked every stairwell path. PEEP valves became standard equipment on every bag valve mask. Irena began teaching 15-minute sessions at the end of each shift for nurses, orderlies, security guards, and residents. The class was called Blackout Drill 3 Commands. The content was simple: low lighting, reduce overstimulation, maintain clear thinking. Hot and cold zones, prioritize airway and circulation, don't get stuck on paperwork. Corridor protocol, separate incoming and outgoing traffic. The drill included practicing without machines, counting pulse by hand, observing chest movement, writing notes with waterproof pens. Dr. Keller started attending these sessions, standing quietly at the back of the room. He signed a new hospital policy, Blackout Protocol = 3 Commands. He returned a metal pen to Irena, engraved with K11 Delta. I used to think these stories were just myths. I was wrong. Small changes appeared throughout the hospital. On crash carts, breath over fear. Under stairwell handrails, if panicking, follow the arrows. In the oxygen storage room, no flames, written in bold, clear letters. The young nurse who had once said paperwork first brought Irena a cup of hot tea and placed it in her hands. I'm sorry, you were right that day. Irena smiled thinly. When it's raining, everyone gets wet. Better to be prepared than angry. Lucas returned to the ED wearing his volunteer badge. He placed a red cord with 3 knots in the communal pen holder with a note. 3 knots, breathe, look separate. Dr. Keller watched his son, then looked at Irena and nodded with understanding. The culture of the hospital began to shift in subtle but important ways. Staff members started taking emergency drills more seriously. They began studying not just protocols, but what to do when protocols failed. Most importantly, they started listening to ideas from unexpected sources. Because they had learned that expertise doesn't always come with the highest rank or the most years of experience. Sometimes it comes from someone who has faced the darkness before and knows how to find the light. Irena continued her quiet routines. She still arrived early to check equipment, still carried waterproof pens, still placed small improvements throughout the hospital that most people never noticed. But now, when she suggested something, people listened. The red cord remained visible on her wrist, not as a boast, but as a reminder. A reminder that there are people in every workplace, every community, every crisis who have the knowledge and skills to help, if only someone gives them the chance. And sometimes when the lights go out and the protocols fail, those quiet, prepared people become the most important voices in the room. Type, I will live kindly. If you believe skills and calmness can turn a blackout into a lesson for an entire hospital. When the lights go out, titles fall away in the darkness. Chief or nurse becomes irrelevant. Breath and clear pathways are the only things that matter. Irena didn't win through arguments or confrontation. She won by opening the right corridor at exactly the right moment. The 3 commands she used that night weren't complex medical procedures or advanced technology. They were simple principles that anyone can apply when crisis strikes. Low lighting, control panic, enable clear thinking. Hot and cold zones, prioritize what's urgent, don't get trapped by bureaucracy. Corridor protocol, keep people moving in the right direction without confusion. These principles work whether you're in a hospital emergency room, a corporate crisis, a family emergency, or any situation where normal systems have failed and people are looking for someone to show them the way. The most powerful part of Irena's story isn't her secret military background or her classified training. It's her understanding that preparation isn't about predicting exactly what will go wrong. It's about developing systems that work when everything goes wrong. She didn't need to be the smartest person in the room or the highest-ranking authority figure. She just needed to be the person who had thought ahead, stayed calm, and focused on what actually mattered when chaos erupted around her. In your own life, you'll face blackout moments, times when normal procedures fail, when technology doesn't work, when the people in charge don't know what to do. Those are the moments when quiet preparation and calm thinking become more valuable than any title or credential. The question isn't whether you have official authority to take action. The question is whether you have the knowledge, the tools, and the courage to help when help is needed. Irena carried waterproof pens because she knew that when power fails, you still need to communicate. She practiced reading vital signs by touch because she knew that machines break down in emergencies. She studied corridor management because she knew that in crisis, people need clear directions more than complex explanations. What are you carrying in your metaphorical pockets? What skills are you developing that might matter when normal systems fail? How are you preparing to be useful in situations you hope never happen? Because when the lights go out in your world, whether literally or figuratively, someone needs to know which way to go. Someone needs to stay calm and focused while others are panicking. Someone needs to remember that breath comes before paperwork, that helping people comes before following rules, and that sometimes the most important thing you can do is simply keep the path clear for others. The darkness doesn't care about your job title, but it does care whether you're ready.
If you believe in stories that touch the heart like this one, leave a comment. And don't forget to subscribe to The Veteran Story. We tell the stories that shouldn't be forgotten. Real people are creating and telling stories, not mass-produced AI.